Thanks to Brendan and to colleagues across ILAS and Quorum for inviting me this afternoon. I'm Dr. Clíona Bhailís. I'm a postdoctoral researcher at the Centre for Disability Law and Policy. We're a centre within the Institute for Life Course and Society, or ILAS. I am bad for acronyms, so I'm very sorry they may sneak in places unbeknownst to me as I go through this, but we are also a member of the School of Law here in the university. So I suppose a little bit of background about me and some context for what I'm going to speak about this afternoon is that I studied law as an undergrad and again as a master's. I worked in the CDLP or the centre then as a research assistant before going on to do a PhD with the centre. And I suppose at a certain point they're going to say I never left, right? I just kind of stuck around. So earlier we heard about how Brendan kind of grew up around Quorum and I lasted in different places. I kind of feel like I did the same thing a little bit in the centre. But all of that is to say that you're going to hear a little bit from me as very much a legal nerd. I'm going to be talking about policy, but also about impacting and working on legislative change or actually changing bits of the law, which is an aspect of our work in the centre. And as well as that, kind of thinking about maybe what shaped me a bit and what I was interested in trying to work within this kind of policy idea into my own work, or some of the things that inspired me as I was doing that. The Centre, for a bit more background and information, does research on disability human rights issues. But we want to do that, and at the centre of our ethos is always doing it in collaboration with disabled people and their representative organisations. There's a broad range of topics that we do this on, from decision-making rights or legal capacity or the right to legal capacity, independent living, care and support for disabled people. We've done projects on sexual and reproductive health rights, recently on children's advocacy, on reviewing the Disability Act in Ireland and how that complies or doesn't comply in certain situations with the UN Convention on the Rights of Persons with Disabilities. So the topics are very, very broad. But I think at the heart of all of them, and certainly at the heart of my research, but I'm very lucky to be surrounded by colleagues that have a lot of the same ethos and are working on this and very much motivated by it, is the idea that we do it in a human rights-based methodology, a collaborative sense. So for us, that often means that you're responding to a rights concern or something that is directly meaningful and impacting disabled people's daily lives. It's not just stuff that's interesting for us. I mean, it is often stuff that's also very interesting for us, but it's going for something that really is impactful and happening to people on the ground day to day, and we're trying to link back with that and support people. That we are collaborating with and having meaningful engagement and involvement with disabled people in our work as much as possible in a way that is appropriate, and that our outputs and what comes from our research goes back to that very community that we're doing it. And that kind of ties me to the policy impact and how we engage, I suppose, from that perspective. So for us, that means that you create outputs from your research that go beyond your journal articles and those kind of ideas. And maybe our alternative format outputs, our accessible outputs, they're videos, they're easy read documents, they're all sorts of different options. They're reports that are published on the Centre's website that disabled people and their representative organisations can use to inform their submissions on policy as well. So it's for us to do it when we have the opportunity as we can, but also in recognition of the central aspects of the convention and the Disabled People's Movement's motto of nothing about us without us, that if they want to write submissions, and they should be and are actively involved in doing that, according to what the convention is telling governments to do, you should go out and ask people what they want, that they can draw on research that we've done to go, and here it's not just happening to us. There is support here that it's happening to other people, or there's alternative solutions. There's things out there if they feel that they're relevant and useful to their work. And then secondly, I suppose that we really want to make sure, because we're often collaborating and gathering the lived experience of disabled people and getting them to tell us their stories, often very traumatic or troubled times in their lives, maybe not all the time, but that can happen, that we then use that to go forward and try and impact change and make change where we can. And that takes a number of different formats, I suppose, and we, try and maximize every opportunity to do that we can. We'll do that at a national level with policy submissions, with trying to engage with different stages of law reform when there's consultations open, when we are fortunate enough to be invited to an Oireachtas committee, which is something that John spoke about. So our parliament may be having a session on something, they've come across our research and they might invite us to speak about something. But also because some of our research, or a good chunk of our research, would be international, that might also mean sharing that with UN special rapporteurs, with the people at a European level, or at different stages of policy, and in doing that. So I suppose it's a really broad idea of what policy is and different types of opportunity. And sometimes you do your very best to write this into a grant, and you have the best laid plans, which is something I'm going to touch on in a minute. And sometimes they work, and sometimes a totally different opportunity will come up, and you just have to go with it and take the chance as it comes along, I think, is often the kind of spirit of the centre, right? That's happening tomorrow. Okay, so we're writing a submission on that now. We weren't yesterday or the day before, but it looks like we are today. And we change and pivot and take the opportunity maybe when it comes. So maybe those are the ones, I think, when they are they're a bit spontaneous, but we do our best to write them into projects as well. So I might share with you now a couple of projects that I was lucky enough to be involved with, and kind of some of the things that we did in those, some planned, some maybe not so planned at various stages, and how that worked for us. So I started as a research assistant in the centre on the Voices of Individuals Collectively Exploring Self-Determination, or Voices project. The director of the centre, Professor Eleanor Flynn, was the principal investigator on that one, and it was funded by a European Research Council starter grant. And it had a novel approach in terms of how it engaged with people, I think, kind of from the outset, in that it didn't interview people, it didn't run focus groups, it didn't do maybe any of the more traditional ways of engagement, in that it paired people with lived experience of disability, of having of people who had experience of having their decision-making rights denied, or had used support to use decision-making with, who were called storytellers in the project, with activists, academics, legal practitioners, different people from around the globe, and there was a storyteller would share their experience, and the respondent, the activist, the academic, or whatever, would bring the context to that, maybe would provide some analysis for that. And they worked together to co-author chapters in a book that was published at the end of the project, and they were from there were 16 pairs from, I think, I don't know if it was 11 or 13 countries globally at the end of that project. I'm going to get it wrong. If I commit to one of them, I'm definitely going to get it wrong. But outside of that, I suppose, academic publication in the book, in a way that would definitely have stories in it and things that were far more accessible maybe than your traditional academic output, but still had a good chunk of legal analysis, we wanted to ensure that those stories, that lived experience, was translated to the people and were heard by people who maybe were in a position to make change in one way, shape or form. So alongside the final conference and book launch for that event, we held a policymaker event in Dublin, where every pair in the project, but predominantly the storyteller, sat with a policymaker of some description and was able to engage with them and share their experience and talk to them about something. So it might have been somebody who was working in criminal justice and looking at redesigning prisons or how we interacted with prisoners. It might have been somebody working in the central bank. There was a judge, there was different officials from different places, and they all sat and they shared those experiences. Some of the individuals kind of chose somebody or suggested somebody themselves, and others then we pitched to people and went, how about this person? I think it would be really relevant and interesting. So that was kind of one unique approach. It's hard to know exactly what impact that had. There was some follow-up, but it was a really interesting way from my perspective to start on that and us going, okay, there's a lot of different ways to do this. Around the same time in the centre, kind of before and after that, we would have also coordinated a capacity coalition. So a coalition of civil society organisations that were working together to influence, I suppose, the drafting process and make a bill that was going through our parliament to change the law on legal capacity or decision making in Ireland and supported decision making and make it more human rights compliant, or think about the ideas that, you know, how will this actually work for people on the ground and is this successful? So in that process, it would have had lots of different perspectives coming together, learning a lot from civil society about their own techniques of influencing policy and engaging with people, meeting with government officials and departments and explaining our work to them and supporting people to get to that stage, and then actually drafting legislative amendments going, you need to change these words in this section, and then if you do that, that will have the following effect on this next, often 20 sections, if you were kind of unfortunate that you have to track through the entire bill and do that at various stages. And then again later in 2022, when they did an amendment bill for that particular law, working with many of the same groups again to go, okay, we didn't get them the first time, what are they doing this time, and how can we revisit some of those points and engage with them in different ways. So there was engaging with the government departments and officials, as I mentioned, but then also working with the opposition TDs and senators or members of parliament and saying, okay, would you propose this amendment for us? And here's why, and here's the importance of this, and trying to inform and educate, I suppose, both sides of the political divide and try and make progress from that different perspectives. And the last one, and I'm conscious of time, I think I'm running a bit tight on it, is how I tried to implement or kind of bring some of these ideas into my most recent Research Ireland funded postdoc on that very act, actually exploring the first few years. So despite that act, the Assisted Decision Making Capacity Act, being passed into law here in Ireland this 2015, they didn't do the additional step of commencing it or giving it legal force. So we didn't actually, nobody could use it, nobody could rely on it until April 2023. And I was hopeful, and I very much thought it would happen in 2022 when I wrote the postdoc application that this act was going to be commenced. And I designed a project around exploring the first few years of the act, professionals' understanding of it and how it was being implemented, but particularly for people who were non-speaking, sometimes speaking, or communicated differently. Because I thought it was a group that is often overlooked, it was a group that unfortunately I ended up maybe not overlooking, but not being able to engage with properly in my PhD research. So I saw it as a gap and something that needed to be addressed, but also a time where I hoped to be able to then influence the next phase of implementation of the Act and feed into the review of the Act that was written into it and lots of different things. And this is where the best laid plans come in. So I haven't quite done that part yet, despite the project being open since last year and having lots of hope to be able to do that, because the department is still working in the background on their consultation mechanisms and how they would want to open that review of the Act and looking at different ways of doing it. I think they had 5 years to do it from its commencement, so they still have lots of time, still lots of work ongoing there, but I still hope to do that. But what did happen was there was many other opportunities, I suppose, to engage that I hadn't written into a plan and I hadn't thought about in different ways. So through colleagues and other connections that I had, the Irish College of General Practitioners were reviewing their syllabus and their curriculum for general practitioners, and I had an opportunity to provide some feedback and submit some thoughts on that. There was a community of practice in Australia and work going on in New Zealand and other places where they were looking at changing their laws in a similar way, and they were wanting to understand what was happening in Ireland and how we could change this internationally. And the director of the Decision Support Service, the body established to run the Act and give it force and kind of oversee the different parts of management of it, was part of my advisory group for that project, and I invited her to provide a response when I was presenting the findings of it, to ensure that the people who are at the heart of doing this are kind of in the room and listening to the outputs of your research, and at least that is the start of the conversation then. Or this was the plan, we will see what the outcomes are. Yeah, and I look forward if people have questions later or further discussions on the panel about any of those.